Good afternoon. We are ready to get started. If you all want to click record. Turn on your mics. Put your cell phones on vibrate or turn them off. So we'll go ahead and get started. We'll have our speakers and then you all can ask some questions. Well, good afternoon. My name is Irma Garza. I'm the PIO for the city of Harlingen, and we thank you so very much for joining us. Please help me welcome our mayor, Chris Boswell.
Thank you, Irma. I'll be brief. We want to thank you all for being out here this afternoon. Of course, we want to thank everybody that's working so hard to take care of everyone who is suffering from COVID-19. Today's press conference, although you're going to hear a lot of information, I think, is really to focus on some things that we're asking the public to help us with right now, things that you and I can all do to help alleviate the pressure on our emergency services system, our emergency rooms, and our hospitals. These are very specific things that we're asking the public to do, and we need the media's attention to help us with that. We hope that the media will help us get this message out as you'll hear about the very, very serious situation, and that you've been hearing about the very serious situation in our hospitals, but also on our first responders and the emergency services funnel that gets people from point A to the hospital, and how we can try to help alleviate the pressure that's happening there. So at this time, I'd like to introduce our county judge, Judge Eddie Trevino. Judge, come on up here and please share some thoughts with us.
Thank you, Mayor. Good afternoon, everybody. First of all, I want to thank Mayor Boswell for the gracious invitation to come and host our press conference here at City Hall in Harlingen. I want to thank him and the City Commission of Harlingen and the management administration at Harlingen for all of the help and support that they've given to us since all of this first began. Let me go over the updated information since our last press conference, which was on August the 16th. So as of yesterday, we are nearing 50,000. We are reporting 48,776 positive COVID cases in our county. This is an increase of approximately 2,115 in 2 weeks. And unfortunately, associated with the increase in positive cases has been a dramatic increase once again, in the number of deaths. We are now reporting 1,763 deaths as a result of COVID-19, an increase of 32 in the last 2 weeks. Our schools have begun their new school year. We won't get into some of the issues that are prevalent there, but we are asking all of the administrators, parents, staff to continue to utilize masks, whether it's mandated or not, for the benefit, protection, and health of their students, their staff, their teachers, their administrations. A year ago, August of 2020, we hit I don't want to say the high point, but the largest number of positive cases, which was over 10,000. Right at 10,069. This year so far, we're at 4,267. In comparison to a year ago, obviously that's better, but in June, May of this year, right, 3 months ago, we were at 860 cases for the month. In June, we were at 1,060. July, 2,200. And now August, 4,200. So again, you see a doubling over the last 3 months. We are hopeful that it does not create another doubling within the next 30 days for the month of September. And that's exactly why Mayor Boswell first mentioned that each of us has to continue to do our part to help our emergency management, to help our hospitals, to help our healthcare professionals and staff, because we are taxing them, we are stretching them beyond their human limit. And in spite of that, they continue to go to work every single day in order to save lives. You'll hear from Manny here in a few moments, but I'll reiterate that there are a few things that all of us can do. At the last press conference, we announced that we were beginning a student vaccination incentive program through Cameron County for ages 12 to 18. They must be enrolled in either junior high or high school. They must receive their first vaccine between August 10th or September through September 30th. And we will be offering a $50 prepaid card that can be picked up at any one of our 4 county public health locations 48 hours after being vaccinated, with proof of attending school in Cameron County, have a valid student ID or some other form of school enrollment, and obviously have a parent or legal guardian present. They're under the age of 18. The immunization will be verified through MTRAC, which you must bring the CDC vaccination card that you receive once you are vaccinated. Those locations are the San Benito Public Health Clinic off the Expressway in San Benito, the Mary Lucio Clinic on Jose Colunga in Brownsville near the airport, the Harlingen Public Health Clinic on 711 North I Street in Harlingen, and the Father Joseph O'Brien Health Clinic on 142 Champion Drive in Port Isabel. You can get the vaccine anywhere, not only at the county clinics, but you must show proof of the vaccination if you intend to take advantage of the incentive program. Our latest numbers, percentage of population 12 and over with at least 1 dose, we're at 88%. Percentage of population fully vaccinated, we're at 73%. The population 65 and over with at least 1 dose, we've hit 92%. And percentage of 65 and over fully vaccinated is 83%. The infusion center, and again, I want to thank Mayor Boswell and the city of Harlingen for their cooperation with our emergency management staff and our public health department, has so far as of yesterday infused a total of 388 patients in approximately 2 weeks. So that's 29 a day. We know that the infusion treatment works. If you've been exposed or you've just tested positive, get with your doctor to get that referral so that you can receive that treatment. It does work. On an unrelated matter, we're thankful to the good Lord that the tropical storm Ida decided to give us at least a natural disaster break as a major hurricane this weekend, and it looks like it's keeping its aim towards Louisiana with heavy rains predicted in the Houston area. Juan, where are you? Can you give us a quick update with regards to that? Yeah, come on up here. You need some airtime.
Good afternoon, everybody. Juan Martinez, Operations Section Chief for the Office of Emergency Management. So in regards to the storm, it does appear that it will be hitting the center of Louisiana, possibly as a high 2 or a category 3 hurricane. We are only expecting rains to fall in East Texas. As we move forward, probably by tomorrow, we'll have more confidence to see exactly how much rain will be falling in East Texas. There are no requests at this time for any type of assistance to any of those agencies. So we're expecting that the rain will be less than 6 inches. We've already made contact with the emergency management coordinators in East Texas, and all of them feel that they should be safe with what's coming, with the information that's given to us at this time.
We'll keep our fingers crossed. We still have another 2 months approximately to deal with hurricane season. So let's keep our fingers crossed and our prayers and our candles lit. Mayor, I want to thank you again for hosting us today and for all of the cooperation and efforts that you and your staff have done with regards to helping us deal with the pandemic. With that in mind, we'll continue to reiterate and ask the public to please do your part. If you have family members that have not yet been vaccinated, please encourage them to do so. You're going to hear from the hospital administrators right now, the impact that it's having upon our staffing and the impact it's having on our healthcare professionals. In spite of the stress that's involved in dealing with life and death situations on a daily basis, they continue to go to work every day in order to try to help each and every one of us. So you can help do your part by making sure that you're vaccinated, that your family members are vaccinated. God bless you. Mayor, thank you for having us today.
And Judge, thank you for your leadership. Now we'd like to introduce Manny Vela, CEO of Valley Baptist Health Systems and Valley Baptist Medical Center, to give us an update on the hospital situation.
Good afternoon, everyone. Judge, Mayor, thank you all for your continued partnership. I sincerely believe and know that our partnership has helped save many lives across our communities, and we can't be more grateful and honored to be serving side by side with each of you. To the media, yet again, thank you all for your time this afternoon. Y'all have helped us tremendously get our word out, and likewise, y'all have helped us save lives as well. The theme of my brief comments this afternoon is simply help us help you. It's that simple. You heard the mayor in regards to the appropriate usage of our EMS system, and I could not have been more succinct or more articulate in laying out those exact situations and scenarios where it's very appropriate to reach out to our EMS personnel. The reality is I went back and looked at some of our notes, Judge, from our first press conference well over a year ago, and looked at some of our press releases. And the theme for 18 months now, we've been on this journey for 18 months, is grave concern over our ability to continue caring for our communities. That's our primary goal as your hospitals here in Cameron County and in the region, right? And so what we have been asking for 18 months now, we're asking yet again, is simply help us help you. And what I mean by that is if you follow the credo that was put forth by the mayor in regards to the appropriate usage of EMS, then they will not be overloaded. And by the same token, if only the folks who need appropriate emergency department care present to the emergency department, then we have a much better chance of being able to appropriately triage and treat those folks. This is a reality in the Rio Grande Valley right now from a hospital perspective. We are all short-staffed. We are well below the staffing levels we were when we went through our first surge last July and August. Big difference is we do not have the military units that were here helping us last July and August through September. We don't have the same level of state strike support personnel helping us. And so every single hospital in our communities is short-staffed, but yet, to the judge's point, the heroes I get to work with and I'm honored to work with on a daily basis come back shift after shift after shift to continue taking care of each of you, your families, your neighbors, our families, our neighbors, our community. So one, please listen to what the mayor said and put that forth to our community. And we're asking the community to take heed, take note, and follow that credo. Two, to the judge's point, the number one defense against the virus right now is getting vaccinated. This remains a pandemic of the unvaccinated right now, and it's being prolonged because unfortunately, we still have those in our community who refuse to be vaccinated. I'm not referencing those who have medical exceptions or even religious exceptions. I respect that. But if you do not have either a religious or a medical exception, folks, please reconsider and get vaccinated. I've invited one of our heroes, one of my heroes, Stephen Hill, my chief nursing officer, to participate this afternoon because I want him to explain and express and to outline and articulate for you what is the status and stage of the mental and physical state of our employees, the people who are the heroes, our frontline workers at the hospital. Stephen, do you mind sharing some thoughts with us?
Good afternoon. Awkward position, to be quite honest with you, but I'm glad to be here and speaking on behalf of healthcare workers. First, I want all of y'all to know, I don't say it enough, that the guys in this room, all the ones behind us that you can't see, have done an absolutely phenomenal job with emergency management, working through this, setting up open communication. Guys, it's been textbook. We've been on the calls 2 to 3 times a week, looking at best ways to care for our community and where we can move resources around and working with each other. So Manny, Judge, everybody, thank y'all very much. Rennie, team, all. So I start with that because even with us doing these calls, trying to work, trying to move resources around, begging staff, we have the staff on call. I'm on communication constantly with the other CNOs in the hospital. And as Manny said, it's tight. It's very tight. And every day we're like, okay, what can we do? Who can we move around? Who needs staff? And we're working with the state and saying, what can we do if we get these resources? And I will tell you, we've been very, very good stewards of the resources the state has sent us to say, who has the ability to make bed capacity so that that next sick person that comes in has that bed. The other thing is, as Manny talked about, overtime's great, as Manny says, until you don't want it anymore or you're tired. And I will tell you guys, our staff are tired. They're working 50, 60, some of them 72 hours a week. We're offering bonuses and things to try to get them to work. And they're doing it for a sense of teamwork, but they're exhausted. And the mental, won't even go through the mental pieces of watching people die or seeing people come in and watching this progression that one day, mom, dad, cousin, or in this case, that's been hard for me to watch is moms and dads who have been vaccinated with the first group, right? 65, 75 years old, watching their 20, 30, 40-year-old children go downhill rapidly going, this is not supposed to happen. He was healthy yesterday. He looked good 2 days ago. And they honestly are just at a loss. And as a healthcare worker, how do you explain to a parent watching their child go through that? And I need y'all to see that is what's going on every single day in all our hospitals in the Valley. That's the best way I can sum it up, Manny. Perfect. Yeah, and I apologize for that. So what we've been doing is trying to get awareness and where everybody at. Guys, for our hospital today, I'm giving you flat out numbers. We have 100 COVID patients in our beds right now. Of those, 5 are vaccinated. Right? If y'all remember the efficacy of the vaccine right up front, they said it's what, 94, 96%. So we're seeing it. The other thing is, without sharing too terribly much, we have 35 patients in our ICU today, all 35 of them on ventilators and 0 vaccinated. And I will tell, I was talking to Dr. Moen just a bit ago, in our hospital, 65% of the patients are under 59 years old. Okay, so it is definitely affecting a younger population and all the struggles with it.
And a year ago, our average age was 20 years.
Definitely, and as the judge just pointed out last year, and I guess that's where I was kind of getting to without articulating it well, is that's been the hardest thing. Is last year you would see an older population and you saw a lot of the nursing home patients coming through, and they were 70, 80, 90 years old. And nobody wants to see a person die, but it was like you had gone through that life cycle, I guess. And it was very, very hard. And seeing that shift as a healthcare worker, how do you care for that, the emotional trauma that goes with that? All right, thank you.
Okay, thanks. Thank you very much, Manny and Steve. And we want to now ask Esmeralda Guajardo, the county Health Director come forward and talk to us about vaccines and boosters.
All right. Well, good afternoon, and thank you, Mayor, for inviting me out here today. I'm not going to touch a whole lot on numbers because the judge did a good job of expressing those, but I do want to point out a few things in terms of vaccinations. Vaccinations is what's going to help us here. And I don't know what else we can do to make you understand this. You know, we've vaccinated thousands of people in our community. Stephen just mentioned how many people are in the hospital that do not have the vaccine. We have seen that based on the people that have died, 98.23 have not been vaccinated. So that's a very small percentage of people that have been vaccinated and that have died. But the issue with them, though, is they had underlying health conditions, and those were the people that we rely on to get the additional dose that I'm about to talk about. People that have they have compromised immune systems, and so we really need to get people to understand the vaccine. You know, last year when we talked about the nursing homes, the reason COVID became such a big issue is because of the number of people that were in nursing homes and people were dying. We're not hearing about it today, and I mean, and then for those of you who do not believe on the vaccine, you have to understand, you have to ask why. You're not hearing about it because the vaccine's working. We have had reports of 21 individuals from nursing homes, from all the nursing homes in Cameron County, and all of them been vaccinated and all of their symptoms have been pretty mild and they've recovered fine. So that just, again, goes to show the efficacy of the vaccine. So I can't express anymore how much the vaccine is working. And so speaking of vaccines, I do want to talk about the boosters that everyone's talking about. So two things, and I think I mentioned this before. There's an additional dose and then there's the booster. Additional dose are for those individuals that because their immune system is compromised, they need to get that additional dose. We recommend, and these are the people that have cancer treatments, stem cell, they've been research, because of stem cell research, they've actually benefited from it. People who've done HIV, organ transplants. And so these people, if you have where your health is an issue that you might have to receive the additional dose, talk to your doctor. Talk to your doctor. The additional dose is not for people that are getting paranoid and they want to go get the vaccine ahead of time. That is not, we follow CDC guidance. And so we're recommending you talk to your doctor whether you should get the additional dose. Now, in terms of the booster is for individuals who the vaccine, the efficacy of the vaccine is waning a bit. So this is where naturally that's what happens lots of times with every vaccine. And so those are right now, the guidance that we're getting is you get that vaccine 8 months after you get your second dose. That puts us at the end because we started vaccinating at the end of December, and those are pretty much healthcare providers. And so those are small target population, healthcare providers, home health agencies, EMS response. Those are the people that will probably be hitting towards the end of September. But the mass public, where we're probably looking at mass vaccination clinics, will probably be towards the end of October. That is when we, as Cameron County Public Health, working with municipalities such as City of Harlingen, with Josh, City of Brownsville, other municipalities, so they can set up mass clinics. And the reason we would look at doing mass clinics is to be able to help meet the demand. Because people, once it's available, we're already getting calls. People want to know they can get it ahead of time. So we're imagining that we're going to have that demand for it. And we want people to go to see their doctor if they're sick. We don't want people that are generally healthy to take up a lot of their time and a lot of the space in terms of scheduling. So we would meet that demand. But that's probably not until the end of October. So right now, please, we ask you to talk to your provider to make sure that you should get the vaccine. 8 months ago, the mayor invited us here to, actually, it was at outside Casa de Amistad, and we had a press conference, the same people. And, as Manny mentioned, and it was for the same topic. At that time, we were just pleading people to stop the movement, stay still, wear a mask, take preventive measures. That's what we were asking for then, and because we didn't have the vaccine. We have the vaccine now. And it's, every day, my thoughts and prayers go out to all the hospital employees. I sit and I worry about my employees working long hours. I can't even imagine what the hospitals go through. And as individuals that have not received the vaccine, let us help you. Talk to us if you don't know why. If you don't want to get it, tell us why. Is it because you think There's these myths going around that the vaccine has chips, that there's magnets in them. That's not true. You can talk to us. We can help you through it. If it's based on your political views, never in 20, and I've just realized the other day, it's 25 years I've been in public health, never had it's been a situation where your vaccine status is based on political beliefs. And it shouldn't be that way. It should be based on what the science tells you. So please, if it's for that, or if you just don't think you need it, you don't know how your body's going to react to this. Don't take the chance. If someone told you you had a 99% chance of winning the lottery, I can bet you're going to go play. We're looking at the numbers, 99% you're going to be good with the vaccine. Take advantage of that. Take advantage of that math. And then those others that are fear, I get that. But let us help you. Let us help you. Call us. We'll talk to you. And we'll try to do everything we can so you can understand why we're here. Because, Manny, the hospitals, if you're not vaccinated, because you may not believe in it or you don't think it's something for you, I'm sure you believe in cancer. I'm sure you believe in heart attacks. And those are the people that are hurting at the end of the day because all the beds are taken for COVID patients who refuse to get vaccinated, who refuse to do anything about it. So please, again, I beg you, I plead, please take advantage of the vaccine. We're here, our hotline 24/7, 3650. Call us and we'll do everything we can. On that note, thank you, Mayor.
Thanks, Aston. Now we want to introduce Bill. I think I'll ask them to come up together and they can tag team this. Bill Aston, the Executive Director of South Texas Emergency Care Foundation. Well, go ahead, Bill, and then we'll have Dr. Moen come up. Go ahead.
Afternoon, Mayor. Thank you for arranging this. We desperately need help and we appreciate the media helping us get the message out to our citizens. A lot of this is about the young men and women you see behind me. I don't know literally how many hundreds and hundreds of COVID patients you've treated, but you have, and you spend hours in the back of ambulances because the hospitals are overwhelmed, and you are the real heroes. It's not people like me that sit behind a desk and use the computer to continue going through the reports and such. But I would like to say this today to our media friends, and please help us if you can. The public does look to you, and we are ready to respond to our community, all of our communities, and we will, and we have been. These young people, our normal call volume is about 66 alarms per day. That's pre-COVID. I was looking at stats this morning and we were around 100 every day in this past week. That's about a 40% or 30% increase in call volume. But we're experiencing numerous calls from citizens who want to be transported to the emergency departments. And they want to go, they tell us, because they want to be tested for COVID. Well, number one, the hospital emergency departments and the hospitals are not COVID test sites. And we've had people sitting in the parking lots for hours wanting to get a COVID test. Additionally, we've seen the increase in 911 calls who think if they call EMS and get in an ambulance, when we get to the hospital, that they're going to go to the front of the line to get into Stephen's emergency room. That's not the case. You're going to be sitting there for hours. I believe in McAllen last week, one ambulance waited 13.5 hours. What are our hours like now, Pete? 1 to 2 hours today, but it's generally at night when we get busier. It's 4 to 5 hours of waiting times. And the hospitals are doing all they can to help us. And we can cover the call volume, but it's those times when they are literally swamped with a shortage of staff. There's beds there, but there's not the staff. And I hope that the governor, Manny, this morning, I read that another group of nursing and other medical personnel may be coming down the next week. I hope that we receive some in the valley. We are very blessed and very fortunate. In 1992, not planning on a pandemic, but working through hurricanes and other major events, we created a first responder program in this community and several other communities such as La Feria, Rio Hondo, San Benito, and so on. We do have a very, very good first responder program, but at the same time, when EMS is tied up at the hospital, our firefighters and trained police officers end up being tied up at the scenes until we can cut units loose from the hospital to respond to calls. We're very proud of the work they're doing, and thankfully they're there. This is a nationwide problem. Actually, when we look at the EMS literature, it's a worldwide problem. Especially in places like Florida, California, here in the state of Texas, the Dallas-Fort Worth area, even in Houston, the larger metropolitan areas where folks are waiting extended long periods of time to get ambulance help. But we want to also say that if you have an emergency, certainly call 911. If you do not have an emergency such as chest pain, and Dr. Moen, I know you can cover this part of it, chest pain, shortness of breath, injuries from a fall, auto accidents and such, please consult your physician. Now, I know that many times physicians are referring the patients to 911, but at least consult with your physicians. And when it comes up to the booster and the additional shots, consult your physicians. We'll work through this. We'll make it through it as a team. We have a marvelous team in Cameron County. Our leaders are absolutely fabulous, and they do what I like to do with my troops. They say, we're not going to get in the way. You go do your jobs. But troops, hang in there. We're trying to help in every way we can. We're very grateful to you for all that you've done. And like I say, I don't know how many hundreds and hundreds, if not thousands, of COVID patients you have individually taken care of, but we appreciate you.
Thank you all. And finally, we have, last but not least, a great emergency room physician and the medical director of the South Texas Emergency Care Foundation, as well as the health authority for the city of Harlingen, Dr. Michael Moen.
Thank you, Mayor. Everybody did a wonderful job. You know, I just kind of want to highlight a few things. One is you have no idea of the heroism that is being seen in the emergency departments and the nursing staff in Cameron County. And what we're trying to do is to get the public to really utilize in a very smart fashion how to use EMS. You call them not to be COVID tested, to be transported for a COVID test. As Mr. Adams said, being transported by EMS for a non-emergent condition will not get you any further in line. See your doctor, call your doctor. If you're not sick, don't call EMS. However, as Mr. Aston talked about, when you've got chest pain, you're a heart patient, you think you're having a heart attack, you're having a stroke, you've been in a significant trauma, motor vehicle accident, severe abdominal pain, you need to go to the emergency department. You'll know what that is, and you call EMS in that instance. The other thing I wanted to talk about, there are two things that you can do to prevent COVID, or if you do have COVID, to really make it better. One is, before COVID, vaccinate. I don't know how many times we've had to say this. I mean, as physicians, and you'll see it across the country, we're fatigued in treating people who don't vaccinate, get horribly ill, and tax the system. So vaccinate. The second is, particularly if you're ill, have had a significant exposure, you've got a lot of underlying medical conditions, monoclonal antibodies work. Without a doubt. There are 2 infusion centers in Harlingen. They can take up to a total of 120 people a day. It's great if you have a physician who can refer you in. They will see you even if you don't have a referral. So let me say that again. Vaccinate, and if you're sick, monoclonal antibody infusion works. And particularly in people who have the tendency to get very ill, utilize it. Thank you.
All right, great. Thank you, Dr. Moen. Just finally, we'll take some questions. In your media packet, you've got this one sheet here that's got kind of 5 things that the public can help us with and help themselves with. Call 911 for emergencies. Don't use the emergency room at the hospital for non-emergency issues. Testing is not available at the hospitals. Patients should consult their doctor first, not the ER. Primary care physicians should refer patients with COVID-19 symptoms to the infusion center, not the ER. An ambulance doesn't help you get to the treated any faster than at the ER. You might want to put, if you could put this up on a graphic, perhaps on the screen, that would be helpful. And these are the kinds of things that we're really asking everyone to help us with, as Manny Vela said, so that let us help you, help yourselves. And this is one way that you can do that so that we don't overtax our hospitals. All right, with that, any questions? You kind of direct them to whoever you think is the best person to answer.
Del 50, el incentivo 269. 69. Esto es del viernes pasado. Sí, en total. Y esto lo estamos ofreciendo, nomás tendrá que llegar a la clínica con el documentación que estén en la escuela. Es bien fácil el proceso.
Yes. Yes. 35 COVID patients. We have additional non-COVID patients in the ICU. That was our count this morning. I don't have that offhand. I apologize.
Will we be able to offering incentives for vaccination?
City Commission's gonna take a look at that on Wednesday, and we maybe offer that sort of program. Based on the City Commission.
Any questions for Dr. Juan? The former state president of the Texas School of Public Relations Association, Chagrin, is very concerned about Aston, our governor, and by the PEA, because we have this Tuesday, the Greenville School District and Wyvern consolidated it from the school district before they had children who tested positive to COVID. These children, by and large, cannot be vaccinated in vaccine approved. They are unable to get remote learning and stay home and stay safe. Very sense to me, I'm asking the next thing to you. Give you what the Greenville and school district superintendent said, and then you give your response. The question I'm asking is, in any sense, the PA or governor would refuse to let our children stay home and safe by remote learning rather than going to school? Big requirement.
Always a tough question. I think that as a governor, I think you need to let each system decide on how they want to approach something. I think remote learning, from the feedback that I get, has not been successful. And I think getting the children back into the classroom is important.
The school districts say they have no choice because they're not going to be funded for those students being at home, not at school. So if they're not able to be funded and get compensated as a school district, they're unwilling to do it.
Oh, I understand that, but I think you put public safety above money. And I think you do what's right for your children, and eventually it will work out.
On the same question, maybe should think our children go to school unvaccinated and they can stay home and remote learning and be safe.
Well, I can't speak to that from my end. I echo exactly what Dr. Mullen said. My mom is a teacher 40 plus years, and she did say the remote learning was extremely difficult. I think we can go back to education, masking, which I know we talked about each individual area doing that, and also teaching the kids hand washing. This might be something we have to live with. Why not start them off and learn how to do it on a daily basis?
Thank you.
Para médico o alguien del hospital en español pudiera explicar lo de llamar 911 solamente si es totalmente necesario.
Does anybody want to handle if not, I'll be happy to. Lo que estábamos platicando al principio, que comentó el alcalde Boswell, lo que yo dije, lo que están diciendo los doctores, Primeramente, si alguien piensa, si no se sienten bien, obviamente sí queremos que hablen al 911, pero lo que estamos diciendo es por el incremento que se han subido los casos en el último mes, hemos visto que se está tardando mucho más y unas personas piensan, si llaman al 911, que pueden recibir el examen del COVID o van a recibir tratamiento del COVID más rápido si de llamar al 911 y no ir al doctor o de esa manera. Les queremos decir que hablando al 911, especialmente si no están tan enfermos o si piensan que van a brincar al frente de la línea en el cuarto de emergencia, eso no va a pasar. Acaban de ver el director que aquí con los que están manejando los ambulancias, ellos están haciendo entre 70 a 100 casos o llamadas cada día. Normalmente es como 60, 65. Y muchos de esos casos son personas que piensan que les van a ayudar. Y la mera verdad es cuando alguien que no está tan enfermo están quitando esos recursos, especialmente de emergencia, están poniendo en riesgo las otras personas que a lo mejor sí están sufriendo de un ataque de corazón, una embolia o han sufrido de un accidente serio. Esto es, por eso estamos diciendo que nosotros tenemos que trabajar como una comunidad unidos para proteger uno al otro. Y tenemos no de utilizar o tratar de utilizar el sistema para su ventaja. Ojalá con eso sí fue la respuesta que estábamos buscando. Los hospitales están en capacidad, pero como el año pasado, ellos siguen buscando el espacio. El problema diferente este año que no tuvimos tanto o que recibimos ayuda el año pasado es que el año pasado el Estado nos ayudó en mandar ayuda, enfermeros, doctores y el ejército para hacer los exámenes. Ahorita estamos pidiendo más y más ayuda, por eso estamos hablando. Oyeron al doctor hablar que los doctores, especialmente los que están en el departamento de emergencia, los que están tratando del COVID, los estamos estresando a lo máximo como ellos son de ser humanos. No tenemos la ayuda adicional que recibimos el año pasado. Le hemos pedido al Estado, pero desgraciadamente todo el Estado está sufriendo del mismo problema. También les hemos pedido ayuda al gobierno federal. Estamos esperando la respuesta. Sí hemos recibido un poco de ayuda en las últimas 2 semanas, pero no es, la mera verdad, no es suficiente para el crisis que estamos viendo en los casos que acabo de decir. Fue de 1,000 a 2,000 a 4,000 en los últimos 3 meses. No queremos que el próximo mes, septiembre, pegamos a los 6 o 8,000 casos porque eso sí se va a inundar la capacidad de nuestro hospital, pero siguen con la capacidad de ayudar a las personas, pero sí están casi llenos. Obviamente esa es la primera, la petición que le estamos pidiendo a la comunidad. Los que no se han vacunado, sinceramente, con toda la alma, les estamos pidiendo por favor que se vacunen, porque esa es la defensa más importante que ya sabemos que trabaja. Oímos que de los 100 personas que están en el hospital con COVID, los hospitales, 95% de esos 100 no están vacunados. Sabemos que la vacuna trabaja. Si hay una razón o una preocupación que alguien tiene que no se quiere vacunar, por favor que nos llamen en el Departamento de Salud Público del condado, hablen con sus doctores para explicar la situación. El miedo no debe ser de la vacuna, debe ser del COVID. Acaban de decir los doctores, desde el año pasado, la mayoría de las personas que estaban en el hospital eran 65 y más. Ahora es de 50 y bajo. Esa diferencia de 20 años, ¿qué es? Son las personas que se vacunaron, que eran los adultos, las personas de mayor edad y la gente joven que no se ha vacunado. Acabamos de ver un día, hace 2 días, a alguien de 27 años que estaba bien, no tenía problemas, desgraciadamente falleció. Y eso está pasando en todo el país. Los niños ahora están saliendo positivo. Al principio, eso no era una preocupación porque el virus original no estaba afectando a los niños. pero ahora estamos viendo que están saliendo positivos y obviamente el variante Delta es más contagiosa y ellos están enfermando a los padres, a los amigos, los maestros X. Por eso esto sigue siendo una crisis de la pandemia que nosotros tenemos que batallar juntos. Porque si no, vamos a seguir perdiendo vidas. 32 personas en las últimas 2 semanas han fallecido por este virus. Y muchas de esas personas bajo la edad de 60 y 50. No debe de ser así porque ya tenemos los armamentos que nos puede ayudar, especialmente, más importante, la vacuna. Dr. Moore.
Those that are in intensive care, how you're handling COVID versus non-COVID patients, and what the difference in the motives are, and, yes.
Well, I'm not really in the intensive care units, but every emergency, every critical patient is taken care of. You try to isolate your COVID patients as best you can. But the problem is the predominance of these COVID pneumonias and how low oxygen that they have. They're critical, they're dying. And there's, unfortunately, once you get to that stage, there is not a lot that can be done. You can steroids, antibiotics, anticoagulants. There are things that we're using, but you know, how often have we been in a pandemic before? So in many respects, we're doing the best we can and trying to treat people in standard treatment protocols that we've used before, but they may or may not be helpful. But that's, you know, once you've gotten there and you haven't vaccinated, which are most of the people in the intensive care unit now, it's too late. So if you are really serious, I mean, you don't want to get COVID, vaccinate. And if you're sick and have underlying medical conditions, get monoclonal antibodies. I know you've heard that before. Sure. That is a great question. Again, we're short of nurses. So we move people around as best we can from the intensive care unit to a step down area and then into the regular medical floor and home as soon as we can. Yeah, I know you can.
Thank you. It's a great answer. I think the other layers that will help answer that question is, as Stephen mentioned, we are juggling every member of our staff that we have in an effort to continue to meet the demands, and we will continue meeting the demands that are brought forth. When you hear us talking about heroes, it's the front line, it's our first responders, it's every single person who's taxed to the limit right now because of the additional demand that's being brought on. And our pitch is really this: if you want to show some respect, some honor, some appreciation to our first responders, to our frontline workers, then please do what we're asking y'all to do. I mean, we've been begging y'all for 18 months. We really have. This is not, it's not for me. Quite honestly, it's for your family. It's for your abuelitos, your abuelitas, tus papás, tus niños, familiares, vecinos. That's what we're asking. But from my perspective, it's I need to protect my team, because if I can't protect my team, we can't serve our community, right? So my primary goal every day I come to work, I count my blessings. I work with the folks I work with, but it's to protect my team, because that's the way we can take care of our communities. That's the way we protect their families and my family as well. Hopefully that helped answer your question.
Do you foresee a vaccine mandate for healthcare workers or teachers or those in nursing home staff?
Well, you know, unfortunately, that should not be a difficult question to answer. But in lieu of the current state of the political and governmental situation, it has become one. I would venture to guess that private businesses and or local governments should have the authority and exercise that authority to protect its employees. And if you have an employee that, for whatever reason, good or if it's a good reason, obviously it's health related, you can't get the vaccine. But for those that don't have that health reason, and they're putting their fellow coworkers at risk, and therefore also putting at risk future treatment, i.e. health insurance or health costs. I think that's something that we're going to be seeing not only across the state, but across the country as the reality is confirmed from a public health standpoint that we have to take care and do what is medically and scientifically recommended. That's what counts. And that's what we should be basing our decisions on.
All right, thank you all very much.
Thank you for helping us get the word out.
Job,